Well, thank you for inviting me to come to your in-service here in the PACU alias Shock and Holding. Today we're going to talk a little bit about blast injuries, an injury that's a fairly common injury associated with terrorist attacks in particular. Now that you see it every night in the news with what's going on in Iraq and the Middle East, it's a very easy type of blast injury to inflict upon a civilian population, and it's a potential injury that we might see here at UCSD. The objectives that we're going to have here, we're going to talk a little bit about the mechanism of how a blast injury occurs, the types of different injuries that you would expect to see with a blast injury, with a primary blast, a secondary blast, as well as the types of internal injuries that you would expect to see. And we'll talk a little bit about the different types of explosive devices that are out there. And right now, explosions are a very low-cost, low-tech way to put together something that will make a social statement if one is so inclined to make that. If you look at Iraq, the roadside incendiary bombs and improvised devices that we have, if you look at the Middle East, if you look in the Philippines and the different areas where you can walk into a nightclub, make a statement by inflicting death, injuries, but more importantly, fear into the population. Those are usually the goals that you try to achieve. It's not how many people you kill, it's not necessarily how many people you injure, but it's the fear and the change of the social structure that you can evoke by doing something like that. Because if you look, the amount of people that actually are killed are relatively small compared to the amount that are wounded, compared to the amount that are completely socially changed the way they do their business. If you look, when have we seen it before? We saw it back in '83 in the Marine Barracks. The Pan Am flight was taken down the World Trade Center. The first attempt to knock down the World Trade Center was with bombs. Oklahoma City was a simple bomb, fertilizer mixed with fuel oil that exploded. We have multiple Middle Eastern bombings. We have the Madrid train station bombings, the coordinated attack to completely stop a city's structure of transportation. And we have the day-to-day occurrences of the bombings in Iraq. If you look at this, 86% of all terrorist incidents that involve the United States have been bombings, and that's pretty much the same worldwide right now. If you want to make a statement, as I said earlier, this is an inexpensive way to do it. And when we talk about suicide, aka homicidal bombings, now it is even a more lethal occurrence because you have people that are willing to wear these things on their body, sneak into an area and blow themselves up rather than putting something there and walking away from it. It adds a whole new dimension into these types of bombs. Well, what kind of energy is created and expended in a bombing injury? Predominantly, this is an exothermic reaction, meaning we're creating heat. We're generating heat from the explosive device that's within the bomb. And in past, we used to think about mining explosives. You had to get large amounts of explosive into an area to blow out the rock. Well, nowadays we're not talking about that. We're talking about just enough explosive now to cause a secondary problem whereby you go ahead and the ball bearings and the nails that are strapped into your packs underneath the explosive are enough to propel. So you essentially are like a machine gun propelling all these little pieces of glass, ball bearings out, and that is essentially what's killing people. Because if you look at the places that have been bombed, these nightclubs, outside of what the damage that the fire has caused and all the glass windows that are blown down, the building hasn't come down or anything, but the people in there are just riddled with the shrapnel from the bomb. The other thing is that when we ignite a bomb, what we're creating is we traditionally have a small fuse that lights the bigger gunpowder collection that's in there. Then that explodes, and that superheats the surrounding area, superheats the gas, and super compresses the gas, and gives us some of the problems. Now, these are just some three definitions here. We have pyrotechnics. It's a type of explosion. It's typically fireworks. That's pyrotechnics. A lot of smoke, a lot of light, a lot of noise, not too much damage unless it lands in the wrong spot. We have propellants. These are things that essentially like air guns or gas guns or rocket launchers. They propel stuff out. You supercharge gas, you super compress gas, and you send it down a pipe, and it will go out and cause whatever you want it to do. A pipe bomb is similar to that in that it's shooting out the sides of the pipe, whatever you put in it, as opposed to an explosive, which just is a random change of energy from whatever that explosive was sitting to into superheated air and combustibles. Now, when we talk about this, these are some of the things that can be used to ignite the explosive charge. You can have heat, okay? So you can take a match, you can put it on there. You see them light the little things to the TNT all the time. We can have friction, which is like a blasting cap. You can sit there and do that and actually explode something. You can have an impact where you throw the device, and when the device impacts on something, it explodes like little poppers that the guys have for fireworks. We can actually have an electrical charge. You can sit there and press the button and push down on it and the thing blows up. Or you can have a shock wave that goes through that. So I have my explosive sitting on the other side of the room, and I take my pistol out and I shoot that, and when the bullet hits that shock wave that hits that causes it to explode secondarily. We have high explosives and we have low explosive potential, and what that means is how rapidly the explosion is moving out from the center of where the explosive device was placed. So here you see it's greater than 3,000 feet per second is a high explosive, and less than 3,000 feet per second is a low explosive device. And I'll show you on a chart here a little bit later the importance of that. Low explosives are just little things that kind of go bang and go poof. They cause a very minimal amount of damage surrounding. Examples of low explosives are the old revolutionary guns where you had the black powder and you put it in there and you saw the click, the flash, the pop, and then it would ignite the bullet and powder, and then it would go out. Not a whole lot of damage because your eye was right there and you didn't get injured. But we do use those and see those still in pipe bombs. They put that low-grade explosive into pipe bombs and use them. It's very common, it's very inexpensive. Smokeless powder is kind of the standard stuff that's used in the industry now to cause actual constructive, if you will, explosions. It's much harder to get because it's a regulated substance and it's much more expensive. So a lot of the people don't use this stuff, and they'll stay with the black powder. Problem with the black powder, it's relatively unstable. So it tends to be not as safe for the person who's putting it together, who's using it, who's storing it, let's say in their apartment or something like that. And that's when you hear people blowing themselves up while they're making their bombs. Okay? The high explosives, in contradistinction to just this kind of little flash in the pan, they detonate and they create a larger explosion, and that is the explosion that causes you the problem. Things that are high explosive, TNT, dynamite, C4 that we have in the military, or regular nitroglycerin, which we've all heard about. Now, also, this is what was used at the Oklahoma bombing, which is an ammonium nitrate, which is simple fertilizer, which you can buy at any feed store. But if you mix the fertilizer with this combination of fuel oil and in the appropriate parts, and you let this thing heat up, the heat that will finally generate will be enough to cause the ammonium nitrate to explode. And it is that explosion of this ammonium nitrate that causes the problem. The amount of ammonium nitrate that they needed to take down the Oklahoma City building was just the same size of a pickup truck, a full-size pickup truck that we have now. If you fill that with the fertilizer just up to the back of the bed, you throw some of this fuel oil in there in the appropriate mixtures in the appropriate spot, throw a tarp over that and pull it in front of a building, you've got enough to take down a building like the Oklahoma. So we see that all the time. We have pickup trucks all over the place. So it's very easy to conceal this stuff and still have tremendous amounts of damages that were out there. And if you go back, this same thing. This is Hobart Towers out of Lebanon. You see the way that pressure wave just takes down the whole front end of the building. Looks just like Oklahoma City. These are very characteristic explosions that occur with these types of bombs. The improvised explosive device is what you see at the roadsides now in Iraq. And these are relatively low-grade explosions that are occurring that have a secondary problem, and that it is moving ball bearings, nails, and glass around, that is going through some of the trucks. So it's not so much that the explosion is blowing the truck completely apart, it's just blowing holes in sides of the truck so all this other stuff can spray through, and then the truck catches on fire. So it's a relatively small amount of explosive contents that's in there that's surrounded by whatever they're going to put there, ball bearings or nails and things like that. They can be detonated by vibrations, they can be detonated by garage door openers, by radio frequency, or they can just go ahead and try and shoot those. That's probably the most difficult way to do it. They'll stand there with a radio control device and do it. And one of the ways the Army's tried to stay ahead of them was some of these convoys, they actually have radio jammers that are out there, or they have radio frequencies on the lead truck that are sending out all sorts of random waveforms to try and blow anything up that might be sitting there. But still, it's a very difficult battle in which to try to win. So you have in these small things, you have a power supply, like a little battery that's in there that can respond to the radio frequency. You have an initiator, which is a small igniting charge, a little piece of that black powder, which then blows up the TNT that's in there. That's your explosive charge. You have an on-off switch so that it's safe when you're working with it, and then you check the safety switch off, and when you place that thing down and you walk away with it from it. And then the packaging is two things. Number one, it's the little container that they put it in, but it's also the jacket that they surround it with when they put the glass and the ball bearings and the nails and things like that. And I'll show you some pictures. And see, these are some of the ways you can ignite it. Light, sound, motion, pressure, vibration, or even temperature changes. So as the day warms up, you can go set it up next to something. As the day warms up, this thing will finally explode when it reaches a certain temperature. Letter bombs are other things that we have to worry about, and the important things about this is to always be suspicious of letter bombs. They're generally packages that are marked personal and confidential. They're poorly written. They may have excess postage. You don't recognize where it's coming from. When you receive things like that, you might consider calling security and ask them to look at that before you just go ahead and open that. Same thing if it shows up at your doorstep at home. You don't know where it came from. It looks suspicious to you. Don't open it up. Call the police, tell them to come over and deal with the issue. And then when it's a bunch of coupons from the cleaners down the street, you can laugh about it. Well, will that happen to you at your home? Probably not. But could that happen here while you're at work? Yes. As I mentioned earlier, this is just a picture of a Chevy truck. Fill that up with ammonium nitrate, and that's about 1,200 pounds of ammonium nitrate, and it's enough to take down the front end of one of these buildings. Here's a briefcase bomb. It's a series of pipe bombs, if you will. They're wired off together. And then you would just take this and you would just pour little ball bearings in there, or a little glass, or you would put nails in there. So when this would explode, not only do you have the explosive blast, but you have all the particles that's also leaving. This is something that you can wear. And see right here, you can go to Home Depot, and that's just a strip of those nails that go through the nail guns that someone has put there. You can do that, or you can just fill it, your pockets full of nails and just hard things that act like hand grenades. And then here's the person that's actually wearing this. So you can put your coat over this, your shirt, or your sweatshirt, you know, and you can relatively easily hide this underneath you, and no one would know that this is happening. So, you know, in San Diego County, if somebody wanted to cause trouble, maybe on the holidays they walk into, you know, Fashion Valley and just stand there and wait till they're in a crowded area and ignite themselves. Here's from the Tobacco in Firearms division here. These are different types of vehicles. This is how much explosive you can put in the trunk, or you can put in the back. Here you can see range from 500 pounds all the way to 60,000 pounds. Now, this is the lethal blast of the air blast, meaning, and I'm going to talk to you about the concussive waves that come out and will take you out. So a simple car is 100 foot. If you fill the trunk up with some TNT and you blow the car up, 100 feet is your lethal kill zone right around there, just through the blast wave. If you take one of these bigger trucks, you've got 300 feet of a kill zone. And if you take a semi and you drive it up and you explode it, you've got a 600-foot kill zone, not to manage all the buildings and things that you're going to cause secondary trauma to the patients. But look how far away you need to be so you don't get the building stuff falling on you. You don't get blown into the building and get a head concussion. For a simple car, you've got to be about 1,500 feet away. For a van, if you will, you have to be 3,700 feet, and you have to be over a mile away from a semi-tractor trailer truck if someone fills that up with explosive and just drives it downtown and explodes that. So imagine the damage that something like that would cause if they drove that into our downtown or into downtown LA. And I don't think these things are too far-fetched to potentially see happens. Well, what happens with the explosion? When the material inside the bomb explodes, it's converted into this kind of superheated, super compressed gas that moves away from the center point of the explosion. So if this is the explosive device, once it ignites, there's a pressure wave that goes out in the 360 degrees. That's called the primary pressure wave. That's the initial thing that when you feel it, you get the blowing of the air, and that's what's going to blow you back. That's also the first concussive wave that's going to go and hit you, get into your lungs, affect your heart, affect your solid organs, as well as affect your GI tract. Well, how does it do that? The way these shock waves hit you is they behave differently, whether it's going through solid, whether it's going through water, or whether it's going through air. And at those interfaces where you go from solid to air or solid to water or air to water, the wave changes its characteristics and causes its most damage. So in particular, blast injury to the lung causes great compression to the lung parenchyma, and that's what causes a lot of your pulmonary hemorrhage and your disruption of your alveoli and your bronchi. So that creates that first big blast that comes out is called your blast wind, or your primary injuring event. That's your positive pressure wave. As that wave moves out, there's a vacuum, if you will, that is created behind that. And that vacuum has to fill with air. And so the initial pressure wave goes out, and then there's a second wave that actually comes back. So in addition to that first wave going through you, now there's a second wave coming back through you. So if you were thrown against a building initially, now you might still be thrown back against another building because you've got these two waves that are going. So if you look at the old atomic bomb pictures from the 50s and the 60s that you can still see, you see that flash of light, and then you see this circular cloud quickly moving out right along the ground. That's your primary blast wave. And so you see all the trees and everything go this way on the cameras. And then all of a sudden it stops and they go like this. And then the negative wave comes back and everything blows in that way. And that's what gets sucked up into the mushroom cloud, that negative way. Okay, so you've got these two things that are going. So your primary sources of injury are the two blast waves, and then what you get blown into, plus all the debris and everything that comes down around you. So you get a pressure wave, you get a blast wave, and you get injured internally. So many people who are not struck by things around them from buildings and glass may look relatively normal, because the blast wave, unless you're really close, is not a particularly disfiguring thing. But it's your internal organs that are predominantly affected, your hollow viscous GI tract and your lungs. So someone could come in here and look relatively normal and have lethal wounds, and you would pick that up because their SATs aren't good, they have a lot of secretions, frothy, bloody secretions, and you'd say, wow, this guy looks pretty good. Why do I see all these things that make me think pulmonary things are going? They've got belly pain because they've blown out part of their GI tract. And their air, fluid, solid interfaces, that's what gets it. So it's easy if the person comes in, they were close to the blast or close to falling debris, they're all cut up, they've got an arm that's blown off, that's one thing. You go, this is a sick person. It's the other person who is within the radius of the lethal zone that still looks very good, that you have to watch out about. And you have to get them intubated, and you have to support them and do the appropriate trauma workup. The different types of blast injuries. So type 1 is your blast wave injury. Your type 2 is from all the flying debris in the buildings. The third one is you being the victim. You're thrown around, you're thrown into a wall, you're thrown up over a fence. And type 4 is just as simple, if you're close enough, the heat wave that hits you, or the actual explosion, the fireball. So if you're close enough, you'll get the blast wave, you get thrown against the building, and you get that fireball that actually burns you. Those are usually lethal injuries when you're that close. I mean, that determines survivability. And it's not always how far away you are. If you're at equidistance between somebody and you happen to be right around the corner of a building, those shock waves will kind of go around you, whereas the person who's standing there with their face right into it gets hit with all these, and you're relatively fine other than your TMs are all blown out, and you have the worst headache and ringing going on in your head, and that person's just gone, you know, they're just completely dead on arrival. So Again, these type 1 injuries, it's due to the pressure, it's due to the solid versus the liquid versus the air interfaces that occur within your body, and it's these rapid changes that causes the structural integrity of these organs to fall apart and shear, if you will, and cause injuries. And the main injuries, the TMs, that's a problem, but that's not a lethal injury. You blow out your tympanic membranes. The lungs is what causes you to die in most of these instances, and causes you to die relatively rapidly if you're not ventilated and supported appropriately. The gastrointestinal tract will rupture, but that will be like anybody else who gets stabbed or gets a gunshot wound to the abdomen. They're going to die much slower, and you might have time to pick up on that because they've got a contamination of their abdominal contents. And the CNS, what they're talking about is head concussions. So even though you're not hit with a baseball bat, you're hit with this concussive wave, and you can still have coup and counter-coup injuries. You still can have subarachnoid bleeds, subdural bleeds, and things like that. Okay. So if your TM's gone, just the typical things that you see: hearing loss, ringing of the ears, the worst headache of your life. A patient with an intact TM is unlikely to have other significant blast injuries unless you see them right in front of you. That is a pearl. So in other words, you're worried about this person who comes in from the blast. Is there a lung injury? Is there GI tract? Look in their TMs, because this is like the weak link. If this is intact, chances are everything else is okay. These are blown out. Then you know that person got a significant blast wave. And so it's very simple test just to look at. Get your otoscope. And we bought a whole bunch of otoscopes and ophthalmoscopes for our packages, our trauma triage packages. So they should be around. So what you get with the pulmonary is a combination of alveolar rupture, bronchial rupture, and intense alveolar hemorrhage that occurs because of disruption that occurs in the lungs. You get the hemorrhage, and then you get pulmonary edema, and you've got to support them. These lacerations of the lung and the pleura act just as if somebody stabbed the patient, so you have to worry about that. They may need a chest tube because they got hemothorax, and then they may need thoracotomy because they have rapidly bleeding intrathoracic wounds. You develop this non-cardiogenic pulmonary edema. It's traumatic edema. It's from the tissues that are being disrupted. And you might see subcutaneous emphysema, mediastinal emphysema, just like a pneumothorax, but it actually is a pneumothorax. It's just decompressing within your skin because there's no hole, there's no stab wound that's coming out, so it can decompress out here. So you've got that spongy subcutaneous crepitance in the neck and in the chest, and you should get a chest x-ray at that point. There's an arterial air embolism syndrome that can occur, but these are usually fatal in these patients. And what occurs is as the blast wave comes through you, the pressure differential changes so quickly that some of the liquid within the blood is actually vaporized, if you will, number one. Number two is you have these bronchial artery disruptions, and then as I'm breathing in, I'm bleeding into my lung from a large artery or vein, and I'm actually sucking in air, and the air is going right in through that venous injury. That usually doesn't happen because usually the tissue around them will compress around that. But because of the blast injury, maybe it's lost that ability. So I'm giving myself my own air embolism as I'm breathing. Remember what to do if you suspect an air embolism. Somebody who's doing well one instant who all of a sudden goes profoundly hypotensive and tachycardic and desaturates. If you're suspicious of that, what side do you put down? And what do you do with the head? You go right side down, right side into the bed, Trendelenburg, and just tip them down like that. And essentially what you're trying to do is trap the air bubbles in the bottom of the atrium or the bottom of the ventricle and not let them get out into the pulmonary outflow tract, and not let them get out of the left side of the heart and get into the coronary arteries. Once they get in the coronary arteries, then you get ischemia, you get airlock, just like a vapor lock you get in your car, and then you can't perfuse your coronaries. So doesn't occur that often, but you just need to think about it. And we talked about what happens in the CNS. It's just like a big concussive wave that comes right through you. And we talked about what happens in the GI tract, how those interfaces change.
Right side, you said?
Left side, I'm sorry. I think I said left side, but right side down on the table and head down. I think I did say right. Okay. Important things. Potentially fatal. Primary blast injuries may not be obvious to you initially. Keep an eye on your patients. As I mentioned, some people are already mortally injured. They're walking around, you don't even realize that. We have some autopsy pictures that I didn't put in here of people from the Middle East from these blast things. You know, and they've got cuts and bruises and some burns that are on them, but they don't look that bad. And then when you look at the lungs and the hollow viscus of the abdomen, it's just terribly macerated tissue. It looks like a hurricane went through there and a blast wave went through there. And you never would have suspected it, I think, by looking at these patients. Blast victims should be managed similar to any other trauma patient. Work them up: airway, breathing, circulation, primary survey, and secondary survey. And they may need to be placed on the ventilator relatively rapidly. If you see these frothy secretions, if you see the patient with hemorrhagic secretions, this is something you want to think about. Arterial gas embolism may benefit for hyperbaric oxygen therapy. I suspect that in the case of a mass casualty injury that we're not using the hyperbaric chamber. It would be very unlikely that we would have something like that going. Here, the trauma that you get from flying debris, violent impact against buildings, bricks falling down, objects falling down, parts of cars being blown up, crush injury and burns, similar to what you'd see right out on the street from a motor vehicle crash with a fire. And these pressure waves are just not familiar to us because we don't see them that much. So, you know, if we had a bunch of these explosions going on, we would become very familiar with it. Our only familiarity may come on the day that this event were to occur. We as healthcare professionals have to just be prepared for all sorts of things that are relatively rare events. But we have to at least think about them and talk about them, and if we each remember just a little piece about it, collectively we might be able to put together what we need on the day of something like this happens, whether it's a blast injury, whether it's a toxin exposure thing that has gone off, whether it's the wildfires again and we have a bunch of burn patients. We just have to adapt. So we try to have these in-services, we try to keep people up to date on things that we don't see every day. We certainly can take a surge capacity of a bunch of trauma patients coming in here because we do it all the time, but put this types of injuries on them and then it's a little different twist. So just be vigilant, keep your eyes open, keep your ears open. Any questions that I could try to answer? Thank you very much for your attention.
Thank you very much.